SMS Dr. Janil Puthucheary.
Mr. Chairman, Singapore is fortunate to have a workforce in the healthcare family driven by professionalism and dedication. Our people answered the call of duty. They have carried us far in this fight against COVID-19 and have contributed to keeping Singapore safe during the pandemic. Our infectious diseases experts and staff at the National Centre for Infectious Diseases, NCID, and other public healthcare institutions have worked to provide clinical guidance to and support for public health operations. Laboratory specialists at the National Public Health Laboratory provided guidance for COVID-19 tests and conducted genomic analyses to support cluster investigations and surveillance for variants. The staff at the public and private healthcare institutions do their duty, putting themselves in harm's way. They undertake healthcare operations in high-risk locations like the foreign worker dormitories, emergency departments, hospital wards, and intensive care units across our healthcare system. I echo the sentiments of many in the House to express our deep appreciation for colleagues in many, many different roles. The work continues, and members will know that we started our national vaccination operations at NCID on the 30th of December 2020. NCID was one of several initiatives and projects that came out of the lessons we learned from SARS. In the test of that crisis, we identified vulnerabilities and in our response developed capabilities and institutions that persist to this day, like NCID, helping us with COVID. And in this crisis, we are learning new lessons and responding to different vulnerabilities. We need to institutionalize the capabilities that we are developing. We have needed to deal with the pandemic and continue the usual clinical services and now stand up a massive national vaccination exercise. Many of these skills, tools, processes, and systems we have developed are distributed across our healthcare network and the care providers. But centrally at MOH, we have had to also develop and improve our organizational capability to manage the response to this crisis and hopefully be better prepared for the next. At MOH, we have set up a new crisis strategy and operations group. They've worked hard in collaboration with other ministries, other agencies to coordinate COVID-related operations. And this is a capability and a team that we will need in order to be better prepared for the next pandemic. We are heartened by the appreciation demonstrated by the public for our healthcare workers. However, today there are still cases of harassment and abuse against staff. This has affected their well-being and their safety. To Dr. Wan Rizal's question, we take abuse and harassment against our healthcare workers very seriously and will not hesitate to take appropriate action when necessary. The enhancements to the Protection from Harassment Act in November 2014 gave additional protection against harassment to public sector healthcare professionals and support care staff. Public healthcare institutions also have policies in place to handle abuse cases. The institutions conduct training for healthcare staff, including on de-escalation measures during potential conflict and abuse. In addition, we will work with the clusters and the Healthcare Services Employees Union on a tripartite effort to strengthen messages against abuse and the harassment of public healthcare sector staff. During the budget debate, Mr. Darrell David asked about staff benefits. Dr. Wan Rizal also asked about this just recently. Our public healthcare institutions do pay close attention to staff leave and make time for sufficient rest. These are all planned to ensure sufficient staffing for patient safety. There are also rostered breaks and staff rotations to ensure sufficient rest during and between shifts. To better support our healthcare staff, a cross-cluster staff well-being committee with representatives from our public healthcare institutions and MOH has been set up, and the committee will share best practices and provide feedback to MOH on possible enhancements to improve staff well-being. Besides healthcare workers, our health tech engineers, health technology engineers have also played an important role. They have rapidly developed systems to support new operational demands, including the ongoing vaccination operations. And these are also important capabilities that we need within our system. And thus, to grow our health technology workforce, we work closely with IHIS, the Integrated Health Information Systems, to redesign jobs and actively recruit people into new roles, including software engineers, systems analysts, and cybersecurity professionals. To facilitate mid-career switches into health tech, IHIS and the Infocom Media Development Authority, IMDA, and SkillsFuture have curated specific training programs. One such example of a mid-career switch is a gentleman by the name of Mr. Daniel Ong, who I spoke to recently. He was a copywriter, and his formal education was in English literature. He couldn't write code before joining IMDA's Tech Immersion and Placement Program, which is part of our Tech Skills Accelerator. In March last year, Daniel began work at IHIS as a front-end developer, and he's contributed to 2 IT projects supporting the fight against COVID-19. Now he's developing the user-facing components of a system supporting the One Rehab framework, which I'll speak a little bit more about later. We hope that more people will see opportunities in this health tech space and embrace the possibility that with some training, they can join the healthcare family, not necessarily as a clinician, but contributing to the success of our public healthcare ecosystem. As Mr. Ang Wei Nung pointed out, we can and should learn many things from our fight against COVID-19. For example, our early, comprehensive, and persistent contact tracing and quarantine efforts have played a key role in our COVID-19 response. Besides the vigilance and skill of our healthcare workforce, our digital tools such as Safe Entry and Trace Together continue to be central to the speed and efficiency of our contact tracing. Coupled with our aggressive testing strategies, these measures have contributed to our success in keeping the number of our community cases under control for now. To swiftly identify COVID-19 cases and contain the outbreak, we have built up our testing capacity and our community testing operations. Through targeted operations as well as routine surveillance testing, such as the testing of our Hawker Center workers, we have so far been able to detect cases and quickly prevent spread. As a repository of patient records, the National Electronic Health Records has also been a key enabler in facilitating this provision of care during the pandemic. Healthcare professionals can access the NEHR for their patients' COVID-19 test results and their existing medical conditions before the vaccinations. The NEHR has also been enhanced this year to meet the requirements for COVID-19 vaccinations, displaying alerts and reporting in prompts. And as we do this, data security remains a key priority. We have been taking steps to improve the security of our NEHR through technical and process enhancements in response to the security reviews that we conducted in 2018. And we expect to complete most of this within the year and onboard more healthcare institutions to contribute to NEHR more securely. Beyond COVID-19, we must be ready to respond to future public health crises by having the right systems and capabilities. We will do so in 4 ways. First, we will enhance our surveillance and response capabilities through the use of new technologies to enable us to more effectively consolidate, analyze, and generate insights from large amounts of data. Second, we will augment our human capabilities to prepare Singapore against future threats. Skilled clinical teams will always play an important role in detecting and managing new diseases and outbreaks. And we also need other experts, such as epidemiologists, data scientists, statisticians, and software engineers like Daniel. We need teams to investigate and perform advanced analytics, for example, to determine the likelihood of spread or to inform our response to an outbreak. Third, while we remain in DORSCON Orange for now, DORSCON stands for Disease Outbreak Response System Condition. We remain in DORSCON Orange for now. We will look into strengthening our DORSCON framework, incorporating lessons learned from the pandemic, so that we can better communicate public health risk and to help us more effectively respond as a whole society when disease X strikes, the next serious pandemic crisis. Finally, we will develop a national research and development program for research in epidemic preparedness and response. And the acronym is appropriately called PREPARE, P-R-E-P-A-R-E, Program for Research in Epidemic Preparedness and Response, to strengthen our R&D capabilities to prevent, prepare, and respond to future public health crises. It will include strengthening infectious disease collaboration networks locally and regionally, strengthening capabilities for the accelerated development of diagnostics, therapeutics, and vaccines, and establishing a national infectious disease repository and database for research and data analysis. To further address Mr. Ang's question, MOH regularly reviews our national response and is conducting an interim review. It will include other ministries and agencies. We will share more details when it is completed. Beyond pandemics, we must ensure that the healthcare needs of our general population are met. The work continues. Our polyclinics are a vital element in our public health primary response. Built in 1980, Clementi Polyclinic is one of our oldest and smaller polyclinics. Its central location has served residents well, with about 850 patients seen per day. We will be redeveloping the polyclinic by 2027 to better serve residents in the region. Dr. Tan Wu Meng asked whether we have considered patients' comfort and staff's performance in our design of healthcare facilities. The answer is yes. When designing new healthcare facilities, the design team will engage stakeholders, including the care team, patients and carers, and the facilities management team. The redeveloped Clementi Polyclinic will undergo the same process. It will be more spacious, with more elderly-friendly and accessibility features. Residents can also look forward to a comprehensive range of primary care services, including medical treatment for acute conditions, chronic disease management, women's and children's health services, as well as radiological, laboratory, and pharmacy services. Another example of the ongoing work to improve routine clinical care services, despite the pandemic, is to ensure our population has timely access to the right level of rehabilitation care. We have developed the National One Rehab Framework. Under this framework, patients will have improved access to community-based rehabilitation and benefit from expanded capacity and capability in the care providers. Our hospitals, polyclinics, and community care providers will embark on a multi-year pilot to validate this new care model. Our hope is for patients with stable musculoskeletal conditions such as lower back pain, who do not require surgery or complex interventions, to receive this rehabilitation care in the community instead of only at specialist clinics or hospitals. During last week's budget debate, we heard Dr. Shahira Abdullah, Ms. Carrie Tan, Dr. Wan Rizal, Ms. Mariam Jaffa, and Mr. Eric Chua speak about mental health. Since the launch of the Community Mental Health Master Plan in 2012 and its enhancement in 2017, we have increased the capacity of community mental health services. We are on track to meeting our targets by end 2021. In primary care, we have over 220 GP partners and 14 polyclinics providing mental health and/or dementia services. We have set up 50 community outreach teams and reached out to over 350,000 persons with mental health or dementia needs. In addition, 21 community intervention teams were established to provide mental health interventions such as psychosocial therapeutic interventions and counseling. We have met our targets of 50 community outreach teams and 18 community intervention teams ahead of our end 2021 timeline. To Dr. Wan Rizal's question on support for youth and their families, we have piloted the Integrated Youth Service within the Agency for Integrated Care, the Institute of Mental Health, and Care Corner, which is one of our community partners in the North. Since April 2020, Care Corner has begun community outreach using online platforms and has reached out to over 2,600 users. In November 2020, Care Corner team moved into the new Wood Square community space to provide face-to-face mental health screening and basic emotional support sessions for persons with mental health challenges, and to conduct experiential resilience or mental well-being events. MOH and AIC have also worked with other community partners to set up youth community outreach teams to reach out to young people in mental distress to provide basic emotional support and resources. The team would also engage the family to understand the stressors and the home environment, and links to social and healthcare services are also provided. Through the Youth Mental Wellbeing Network, we have heard from the youth, the mental health and social sector professionals, patients and caregivers on how we could improve the mental well-being of our young people. Minister of State Sun Xueling earlier shared on how the network has initiated ideas for over 30 potential ground-up projects. Parliamentary Secretary Eric Chua will also be sharing about an initiative to provide positive peer support during his MSF speech. The three of us are working together, just as MOE, MSF and MOH are working together on this important area. To To look into the psychosocial impact on the COVID-19 pandemic on the population, we've set up the COVID-19 Mental Wellness Task Force in October 2020. The task force has reviewed and recommended 3 areas to work on, namely to develop a national mental health and well-being strategy, secondly, a national mental health resources page, and a national mental health competency training framework. Beyond COVID-19, we will evolve the task force into an interagency platform on mental health and well-being by mid-2021. The platform will oversee mental health and well-being efforts, focusing on cross-cutting issues that require multi- and interagency collaborations. We're working out the details of the platform and we'll share more when we're ready. Dr. Tanya Swam asked about the support for other vulnerable groups, such as our seniors, and building a more inclusive society. The government recognizes that those who suffer from mental health conditions may face discrimination. We've been working with partners to roll out initiatives to address this issue. It will take a whole-of-society approach to tackle this issue effectively. The National Council of Social Services launched the Beyond the Label movement in 2018 to fight the stigma of mental health conditions and encourage social inclusion, positive attitudes, and support towards persons living with mental health conditions. The movement also provides a platform for more conversations about mental health and promotes greater awareness and the acceptance of mental health conditions among the public. To reach out to persons with or at risk of mental health conditions or dementia, including seniors, community teams also reach out to residents and their caregivers to provide mental health or dementia information, basic emotional support, and links to appropriate services, health or social, as necessary. For seniors at risk of social isolation, the AACs, the Silver Generation offices, the local grassroots organizations connect them to befrienders who will reach out on a regular basis, providing companionship and encourage them to participate in social activities, keeping active and keeping connected with the local community. Seniors can also sign up with CareLine, which is a 24/7 social support hotline providing tele-befriending services, as well as emergency response to seniors in distress. And while we do all this to build up the capability in our community partners, we will make sure that our main psychiatric sector, IMH, is updated. Since 2018, IMH has been undergoing refurbishment and improvement works to facilitate the care and improve operational efficiency and safety for patients and staff. And these works are expected to be completed by the end of 2022. Mr. Chairman, to fight COVID-19, we have had to rely on the skill, dedication, professionalism of our people. We've had to develop and deploy technology, and we've had to scale up clinical services, all the while looking after the many healthcare issues that are unrelated to the pandemic, but essential to our health. We've had to be agile, steadfast, and determined. We are all a bit tired and fatigued, but also hopeful and confident that we can find our way forward. Our ability to get this far was the result of many years of investing in our people, our facilities, systems, research, and capabilities. We must learn the lessons from this experience. The preparations for the next crisis, whatever it is, are underway and require that we keep ourselves and our healthcare system in good health. Prevention is best. Preparation is also necessary. Thank you.